Good afternoon and welcome to Let's Chat with Dr. Celeste, MD. I'm your host, Dr. Celeste Reese-Willis. I am your board-certified family medicine physician specializing in urgent care. I assist busy professionals to find solutions for both their acute and chronic medical needs. We do this through our primary care, COVID vaccines, COVID-19 testing, as well as through concierge medicine and telemedicine, as well as through our brand new Amazon best-selling book, Vitality. In addition to that, we are on house calls every Monday morning at 6:30 a.m. We're on this morning talking about RSV. So that's another way that we help to educate our patients. So today's topic for our Let's Chat is bullying. If you guys will notice, we are now coming to you live every Monday during the lunchtime hour. Trying to do better with self-care. So we're switching from Sundays to Mondays because that helps a little bit better with our schedule. And I hope that you guys are able to hop on. Hopefully we're able to share some information that will be beneficial for you. As you're aware, we do try and bring you very timely health topics to talk about and discuss. This month, one of the topics is bullying, and this is sometimes a topic that kind of flies under the radar because sometimes people don't think of it as a health topic. The reason that we're talking about it today is because of the impact that it has on our children in terms of anxiety, in terms of depression. In addition to that, there have been some recent articles in the paper about some tragedies that have occurred as a result of bullying. So very much need to bring awareness to this much needed topic. So today's topic is bullying. We're going to talk about 5 tips to help decrease bullying and things that you can share with either your children, that you can share with other parents that you know, or that you can help to be a part of the solution for. So in the last year, and definitely during this pandemic, we have seen an increase in the amount of bullying. 20% of U.S. high school students are reporting currently that they currently experience bullying. 15% of those have reported what we call cyberbullying, and this is bullying that occurs as a result or on social media. So very much needed topic. So that's 1 in every 5 high school students is bullied every day. And so that is kind of heavy. A lot, children today are dealing with a lot. We're dealing with a lot anyway as a result of the pandemic and a result of COVID-19. But most importantly, kids are dealing with a lot just in the different way that in the different environment they're having to learn in terms of using masks, in terms of being distanced, in terms of teachers not having the typical things that we would have, what we're accustomed to prior to this pandemic that hit a little under 2 years ago. So we want to make sure that we bring awareness to this. We want to make sure that we do things to help protect our kids, and we help present an environment that is beneficial for them for learning. So 5 top tips on how you can help to decrease bullying both in the school and outside of the home. And this is a conversation not just for kids, not just for parents. This is a conversation for kids, for parents, for teachers, for any adults that are in an environment where you've witnessed or seen children experience bullying. There's something that you can do. So 5 top tips. Number 1, it starts at home. We've got to make sure that we're educating our kids. We've got to make sure that we have the conversation. Talk to your child about what bullying is, about what behavior from another child is acceptable and what is not acceptable. Talk to them about what a healthy friendship is. Talk to them every day. Talk to your child. Ask them, hey, how was school today? Anything interesting happen at school today? Okay. So we want to make sure that they have that conversation first that starts at home so that the child is aware, hey, this is not normal behavior. If this happens, you need to let me know, let your teacher know. Okay. So that was the first thing. Number 2, know the signs of bullying. Children always exhibit signs, and there are a lot of times things that they share with us and that they tell us that will let us know, hey, this is a child that may be being bullied. So if they're avoiding school or avoiding school activities, they may be being bullied. If they are avoiding, or you notice a change in their hygiene or change in their eating habits, that sometimes is a sign that, hey, this child may be being bullied. If you notice that there has been a drop in their grades, that could be a sign of them being bullied. And more importantly, mood and personality changes. If your child seems to be very different, very unlike the child that you know them to be, you may want to hint around and ask some questions. Ask them about their friends. Ask about their interactions with their friends. If they go out with their friends for a social moment, ask about those things. If you hear them talking about another child that may be being bullied, ask them the question so that you can get to the bottom of, okay, is there bullying going on? Is it happening with my child? You also want to ask questions because the last thing you want as a parent is to receive a call from the principal that your child is the one that's bullying other children, right? Right, because we want to make sure that we're clear about this. Bullying is socially unacceptable, especially in 2021, okay? Number 3, third tip to help decrease bullying: empower your children. Explain to them, give them options, tell them, hey, these are some of the things that you can do if you find yourself in that situation. You're the first person that child is going to look to for guidance, for support on mom or dad. What do I do? How do I handle this situation? Right? Right. So talk to your child about, hey, no one to hold them, no one to fold them, no one to walk away. Right? So talk to them about, hey, walk away from it, especially if it's a situation that they can completely just walk away from. Just because someone's saying something to you that is unpleasant doesn't mean that you have to sit there and listen and accept what it is they're saying. A lot of times there's a lot of power that you can find in simply walking away and taking yourself away from the conversation or away from that group. Number 2, tell an adult. Share with them to tell an adult, whether teacher, principal, someone, about the bullying that is going on, because they may be bullying your child now, but they could be doing it with someone else later on, right? Right. Lastly, empower your child. Show them, tell them, hey, if someone is doing this to you, just tell the bully no, or tell them to stop it. If they say, this is one of the favorite things I've heard, and I think this, I don't know if this is something teenagers are saying, you guys may be able to tell me or not, but I heard that they say, ask them who asked. So in other words, if they're giving you some information that you don't want to hear, and, just ask them, say, who asked? Be firm with them, be firm with the bully and tell them no in a firm voice. Number 4, you want to report it. As an adult, if you know about it, please make sure that you report it or you take measures or steps to protect that child. If it is not your child, please care and think, let's put the children first. And remember, it's not your child today, but it could be your child tomorrow. So if you hear about it, you want to make sure that you report it to the right entity in that school or in that situation so that we make sure that this child who's doing the bullying, is gotten under control. Okay. Number 5, you want to get other parents on the same page with you. Ask other parents to commit to stopping bullying in that school. Most schools today have some kind of bullying prevention program. Make sure that you're a part of that committee. Make sure that you're part of those programs. When those programs, those awarenesses come about, make sure that is something that you support. One of the only ways that we can stop things of this nature is to bring the cover out from over. A lot of times, kids back in the day would get away with bullying because you didn't know and people didn't really talk about it. Well, today it is not socially acceptable to bully other individuals, whether in or outside of school. It's not a cute look, not something that is looked upon as being socially acceptable. No one looks up to you for bullying other people. So we want to make sure that we get other parents to commit to this program and to the prevention of it for the betterment of all the schools. And then lastly, make sure that you spend time at the school so that the school knows that you're invested in your child, you want to know what's going on, and to know that you're there to help be a part of the solution. Okay? So those are 5 tips again to help stop bullying. We're going to make sure that we educate our child at home, have the conversation, tell them what it is, tell them what friendship behavior is acceptable, what is not acceptable, because they're kids, so sometimes they don't know. Number 2, know the signs of bullying. If your child stops eating, changes their hygiene, notice a drop in their grades, they're avoiding any kind of school activities, ask the questions, get down to the bottom of it. Don't just brush that under the rug. There usually is, where you see smoke, there's fire. Number 3, empower your kids. Tell them what to do. Walk away. Tell the bully to stop. Number 4, report it if you know about it. Get other parents with you. Number 5, get other parents to commit to the bullying prevention program that's a part of the school. Make it fun. And then lastly, spend time at the school so that they know that you are invested in your child and your child's experience. Okay? So I hope that all of that was helpful. Lastly, I know that we talked about, it's Breast Cancer Awareness Month. And so on our last Facebook Live last week, we talked about the fact that breast cancer was irrespective of age and that there are young people that get breast cancer that do die. So what we want to make sure that we talk about now is the fact that men can get breast cancer. We want to dispel that myth. Absolutely, men can get breast cancer. If you have family history of breast cancer, men, talk with your physician, see them, and find out what, if any, screening tests it is that you may need. Okay? Does anyone have any questions? Hold on a second. Let's see here. Okay. Hey, pretty Barbie, how are you? It's been a minute. I recently lost a close best friend. Oh, I'm so sorry. Oh, pretty Barbie, I'm so sorry about that, about your friend that you lost as a result of COVID. I wish I could say that this was not common or it wasn't a story that I heard commonly, but unfortunately it has. Yes, death is unfortunately very unpredictable, especially in the age of COVID that we're living in. So my sincerest condolences to you and to that family. I just feel really badly. I'm so sorry that happened. I know that you're fully vaccinated because you told me that you are. I encourage you to continue to do those things that you know that you can do to help decrease the spread of COVID in your community. I know that you're vaccinated. If the booster vaccination applies to you, I would definitely get it. At this point, I know that they made some other changes. They officially approved the Moderna booster dose for those individuals that we've been giving the Pfizer booster dose as well as Moderna booster dose to. And that would be those individuals over 65 years old, those individuals that are healthcare workers as well, anyone that is immunocompromised, anyone with severe comorbidities that make you at increased risk, or anyone that is in a high risk environment would need a booster dose. That is what the current guideline, where we are with the current guidelines. I would encourage you guys to speak with your physician to find out if that applies to you. If it does, I encourage you to go ahead and get that booster dose. A lot of the numbers, we're seeing some of those come down. We're seeing some of the number of people on ventilators. That has come down some, but we are still, make no mistake about it, we're definitely still in a pandemic. We have seen COVID in the last year and almost 2 years at this point oscillate up and down. So we want to make sure that we do not get lost too much in that report of, oh, it looks like things are getting better. They are getting better, which is great and phenomenal. And there's nothing that we would love more than to be out of this, but we're not out of it quite yet. So it is important that we continue to do those things that we know that we were doing before that help to decrease the spread of COVID in our community. So I encourage you guys to do that. Again, if the booster dose applies to you, I encourage you to go ahead and get it. And again, Pretty Barbie, so sorry about your friend. It seems like every day I'm hearing about, in fact, every day I do hear about someone that has lost someone that is close to them as a result of COVID-19. So this disease, ladies and gentlemen, is not gone just yet. Our prayer has not been answered just yet, but we're still praying and we're still on the front lines trying to help to decrease the spread of this virus in our community. So on that note, if you are in need of vaccinations, we actually have all three vaccinations. We have Pfizer, Moderna, as well as Johnson & Johnson at our office. The number is 205-291-8842. If you're in need of a COVID vaccine, whether first, second, or third dose, if that applies to you. And then if you're in need of COVID testing, we're still continuing to provide COVID testing as well. So I'm really sorry about your friend, Pretty Barbie. You got me stumped on that one just a little bit, just because that's unfortunately a common story that we're hearing more and more, unfortunately. But sorry, my condolences to you and to that family. Again, if you're in need of testing We provide testing. If you're in need of vaccines, we provide those as well. I encourage you guys to continue to do the same things we know, guys, that have worked. We've been having this conversation for a year and a half now, and I know that some of you are probably tired of hearing about it, but it's still here. So we're still fighting it. So we're fighting to find balance in a place of normality within this pandemic, and doing so in terms of just what we do with work, with seeing family, things of that nature. So we're still here. So we're going to make sure that we're drinking 2 liters of water a day, right? We're going to make sure that we are, and there it is, masking when we leave. We're going to make sure that we're careful about different environments that we're in. Be careful when you travel. I have traveled and been able to actually fly. In the past couple of months, I've done so very easily, felt completely safe, but, still, took my precautions and such. And that's not an advertisement, by the way, to, hey, go out and take a flight, but just kind of sharing information that I think will be valuable to you, that it's possible to do so. You just need to make sure you take the precautions and that you mask up. Hey, Stacy, how are you? Thank you for tuning in. And she put, it's more prevalent in the workplace than you think that bullying is. Yes, so that's interesting, Stacy. So bullying happens with children, but if you'll notice, we talked about 5 tips to help decrease bullying. I didn't specify it to children because unfortunately bullying does happen with adults as well. And the tips are pretty much the same in terms of acknowledging it, knowing and deciding what is acceptable behavior, what is not, empowering yourself and, telling someone no. And sometimes, it takes a while, especially if you're someone that's a people pleaser, or you're someone that's so accustomed to wanting to make everyone happy that you'd want to say yes for everything. But sometimes we've got to learn to say no for the benefit of our own self-care. Report bullying if you see it, whether in school or the workplace, and ask others to commit with you to not allow bullying to happen in your work environment nor school environment. Okay? She's such a joy, and I'm too tired of hearing. She said she's tired of hearing it too about COVID. Yeah, I know a lot of people are tired of hearing about COVID. That's why sometimes I only talk about it if I'm asked, because they're like, Dr. Celeste, we don't want to hear about that anymore. But sometimes it begs the question, and we have to talk about it. Or I just don't want to be here no more. I have to take the blessing that he still has me here healthy. She said, seriously got you to the point you didn't want to be here anymore. So Pretty Barbie, we got to have a different conversation now. I'm going to inbox you in a second, okay? Because I want to respond to your comment, but I want to do so offline. Does anyone have any other questions? Anyone have any other questions? The one thing that I will say, in response to your comment, you said you want to take the blessing that he still has you here and healthy. And so what I think that means is that he's, obviously has things here that he still needs you to do. And so he's kind of not ready for you to be gone, right? Right. And so sometimes things like this happen because if you'll notice, since COVID, we have a different appreciation of spending time with the people we love and care about now, don't we? Mm-hmm. So now when you spend time with people you love and care about, it's more special. It means more to you. And you probably want to do it more now than we probably would have taken the time before, because we have been shown that life is unpredictable and that things can come in that turn our lives and what happens in our lives upside down, completely upside down, and even rearrange our purpose in life, right? Right. With what will happen with life. So definitely there's a lot still here that he has for you to do, Pretty Barbie. But I'm going to inbox you in just a second, if you don't mind responding. And does anyone have any other questions? So hopefully, and now if this information has been helpful to you, please share this information. If this is information that you feel could be helpful for someone else, please share it with them, especially with other parents or with students, or people who you think need it. If you think there's someone being bullied, and let's say it's not your child, or let's say it's someone else's child, obviously if it's an adult doing something to a child, that's child abuse, so that we would have to call authorities for that particular purpose. But if it is a child or another adult, and you have a way of segueing in to help that child, then please do so. Share this information. She said the COVID caused her to feel depressed and has her feeling like that. So pretty, Barbie. That's so interesting. That's one of our next topics that we wanted to talk about, is the effect of anxiety and depression as a result of COVID. And I'll go ahead and give you a teaser that is something that we're going to talk about, I think, next week on our House Calls episode on CBS 42 News. That's one of the topics that we're going to talk about. On Monday. But because there is a scientific, it's been linked that there are cases of anxiety disorder and depression that have resulted directly as a result of having COVID-19. So that is actually a real thing and a real issue. And so it's something that, needs to be addressed full ways around, with kids, with adults, with anyone that in turn is dealing with COVID. And it's something that has impacted people in all different varieties and has caused it. People who never had anxiety or never had depression before have developed it as a result of having COVID. So this is not something that is unheard of or not unusual. So, but I'm glad that you're okay, Pretty Barbie, and I'm glad that you were able to show up with us today. I am going to inbox you, so please inbox me back. Any other questions? You are welcome, Stacy. Thank you guys for tuning in. Thank you for taking time out of your lunchtime schedule to tune in for this today. I'm trying to find out if this is a good mix. Sundays just are not working well with my efforts at self-care, and I'm committed to being better about self-care and taking better care of myself as I take care of other people. So we won't be doing it on Sundays anymore as a result of that. She said, just anxiety now than ever before. Yes. And so that's so interesting. So I guess we're going to talk about it now. So there are people who never, ever had issues with anxiety, depression, Stacy, that have reported exactly what you're saying to me, where they never had anxiety before, never had depression before, never had a panic attack before. But since they've gotten COVID, it has affected them in that way. And that is the one thing. And that's one of the important reasons why, making COVID, public enemy number one, and that we are all united on the fact that we want it gone. Well, I think we're united on the fact that everyone wants COVID gone or non-existent, right? But one of the things that has happened to a lot of people is that this has happened where they've developed an anxiety disorder or developed depression when they didn't have it before, or had anxiety attacks. COVID is a viral infection that once it gets into your body, and we know it enters through your eyes, your nose, or your mouth, once it gets into your cells, makes more copies of itself, reproduces itself, and sets itself out and starts to attack the organs of your body. Now, it can attack your liver, your kidneys, your heart, your lungs. We know that it can attack your lungs, but it also can attack your brain. And these are the varying ways in which we've seen people present. So this is a real disease process. And so this is something that you need treatment for that. You need to be evaluated for that to make sure that you're being treated for it, and to make sure, number one, the first thing we want to make sure is that you're not having any thoughts of wanting to hurt yourself or wanting to hurt someone else. True anxiety and depression can make you feel that way. And it's a hormonal thing. A lot of times when people have anxiety or depression, it's because their hormone levels, their neurohormone levels, are abnormal and not stable. The medication helps to stabilize those hormone levels, which is what helps to take that sense of anxiety or helps to take that sense of depression away, right? Right. So, it's not you being paranoid. I've talked to people, and that's another topic we could talk about. And this is going longer than we thought it would, but is the long hauler symptoms and side effects as a result of COVID. Some of it is seeing people that have a bump in kidney function. I'm seeing that a lot, especially in African American patients that have been positive for COVID. So if you've been positive for COVID before and you haven't had a visit with your primary care physician, just a general checkup to make sure, hey, want to make sure my kidney function's okay. Want to make sure my liver functions okay. Want to make sure, and you may not have had, and this has happened in individuals. It's not only in those individuals who are like, I was extremely short of breath when I had COVID. Oh, I had a lot of coughing, a lot of chest congestion, a lot of loss of taste and smell. We are seeing it in patients who have had no symptoms at all, right? So the point of me saying that is it's important if you're positive for COVID to follow up and make sure you wait long enough. If you try and go see your primary care and you had COVID 2 weeks ago, they may not see you for an appointment. I'm not going to, they may not see you. I know here, before I see patients for a primary care appointment, we'll do a rapid COVID test on them before I'm behind the door with them, because I'm in a tight enclosed space in an exam room, right? Right. So we want to make sure that, I'm not exposed, they're not exposed, that kind of thing. So we'll do that. But you want to make sure about it at least a month, maybe about a month or so after that you see your primary care doctor, to make sure that you get blood work checked, to make sure that your lungs are okay. There are individuals who had no lung symptoms at all that have reported lung issues after having had COVID, and they didn't have respiratory issues at the time. So there is what we call a long hauler effect of COVID-19 that can affect different organ systems. So we want to make sure that we do that. Do your visit with your primary care physician. If you have kids and they've had COVID, have them see their pediatrician for a follow-up appointment. They need that. It's important. Don't underestimate that, because it happens all the time. So that anxiety and depression is another long hauler symptom of COVID-19. And that's something that needs to be addressed, just like the bump in kidney function that we're seeing in some of those patients, as well as bump in liver function. Okay? Does that help? I hope that was helpful. Self-care now includes targeted mental health care. Exactly. And you know what? That's awesome that the VA provides that for their employees. I think every no matter what capacity you work in other words, whether you work in healthcare, whether you work in ministry, whether you work in education, whether you work, in the service industry, in the food industry, it doesn't matter where. I think that having mental health care is so vital and so much more important today than it ever has been. I'm sure that you guys know the story about the child, I think that was last week, that came to school and brought a gun to school and killed kids, because he was tired of being bullied. You know what I mean? So mental health care is at an all-time need, period. I mean, we need more psychiatrists and psychologists and therapists to help us work through all of this. What has impacted us the last year and a half, we don't know the mental effects we'll have for that for years to come. And we're still in it. We're fighting it and still in it. I think especially healthcare workers need, mental health care after going through, listening to and dealing with people dying every day as a result of COVID, dealing with just the different things that you deal with, seeing the children that you see impacted as a result of COVID-19, or the families, or what's happened to some families, losing 2, 3, 4, 5 family members at a time. That's a lot. That's heavy mentally. And so it takes a lot to work through that. And so mental health care is at an all-time high in terms of need. And hopefully they won't that we won't have a lack in being able to address that. And I hope that what we can do is take some of the stigma off of it, so that when people need help and need to see a therapist, that they're not embarrassed, or they don't feel like, I don't know if this is what I want to do, or, macho, or whatever we want to say, to be able to do it. Because, yeah, and she's right. Stacy, you're so right. We all need it for balance. We absolutely do, in every field, I think. But I could sit here and talk to you all day about COVID, especially and the effects of it, but especially seeing it every day. But I've got to, it's 1:00. I have some patients that are here. So now I have to go. I didn't realize I logged on that late. I try to log on at 12:00, but sometimes I'm still finishing up with the morning patient. So, but anyway, happy Monday, everybody. Thank you, Pretty Barbie. Thank you, Stacy, for tuning in. If you're in need of testing or vaccines, we'll be more than happy to provide those to you. You can reach us 205-291-8842. Again, I'm Dr. Celeste, your favorite urgent care physician and board-certified family medicine physician specializing in urgent care. Have a good day. Happy Monday, and we'll see you next time, okay? Bye.